We're looking at a variety of issues cross-government. Minister Fleming is working with stakeholders in the education system to get the online learning working in every corner of the province. We've seen some really good success, and again, a level of collaboration between educators, superintendents, school board trustees, parents, children, the whole continuum of components of our K-12 system working cooperatively to try and find a way forward through this virtual period, and also having those preliminary discussions about how we would, if the curve continues and we get positive signals from Dr. Henry and the modeling in the weeks ahead, that we would be able to look at bringing kids back to classrooms. But I look at my colleagues across the country who set arbitrary dates for a return before the data was in, before the science was confirming that, and we're not going to follow that lead. We're going to look at the numbers as they emerge over the weeks ahead before we make those determinations. When it comes to other components in the economy, of course, the capacity in our acute care system is robust. That's at the cost of those elective surgeries that we very, very regrettably, Minister Dix and I and the entire government were frustrated that was a step we had to take, but an important one. And I think that will be a place where we will start to look at moving more people back into our acute care system again when the evidence presents itself, so we can do that. When it comes to other elements of the economy, what we've been trying to do, Justine, is to not shut down everything. There was a lot of talk about lockdown this and lockdown that. Other jurisdictions use that language, and then they publish their exemption lists, which were sometimes pages long. What we've tried to do is make sure that we have safe workplaces, and that's having our WorkSafe minister, our WorkSafe staff, coordinating with public health officials to make sure that we can ensure that work can carry on in British Columbia, whether it be in the construction sector, whether it be in public transit, and so on. And we'll be able to start things up, I think, because of our early start to prepare for the pandemic. I think we'll be in a better position when the restart happens. But that's what part of what the Economic Recovery Task Force is talking about weekly with Minister James and Minister Mungal and I, as well as the conversations I'm having with industry leaders, sector by sector, with the environmental community, with the agriculture sector, forestry, and so on, to make sure that all of the stakeholders have an understanding of where we're going, and that when the start-up begins, sometime in the not-too-distant future, again, when the evidence presents itself, I think we'll be in a good place. But we're planning for that and have been planning for it for a number of weeks, making sure that the lines of communication between the players, labor, industry, communities, are as robust as they can be. When you see the modeling on Friday and look at the modeling that was done a few weeks back, you'll see that were it not for these measures, the outcomes would have been far different. Were it not for the collective effort of British Columbians, we would have seen a different outcome. And that's obviously transparent when you look to the south of us in the United States, where there are extraordinary numbers of deaths, numbers of infected, and still no real understanding of where the virus is going south of us in the United States. We adopted early. We adopted those initiatives that Dr. Henry put before us, making sure that if we were not feeling well, we self-isolated, making sure that when we were out interacting with the public, we were doing it at safe distances, constantly washing our hands, sanitizing wherever possible our workplaces if we were at work or at home. These initiatives made a difference, and stopping mass gatherings made a difference, and that's what the evidence clearly demonstrates. And I think British Columbians, although it's been a very difficult road, I'm not diminishing that, if you look at the results, we should be proud of what we've been able to accomplish, and the sooner we get that curve flattened completely, the sooner we'll be able to get back to a sense of normalcy that we're all yearning for at this point.